Welcome to the online training course, Emergency Planning for Local Public Health. This awareness course presents an up-to-date overview of emergency planning, highlighting the role of public health in planning for and responding to emergencies. This course has been created for local public health workers and others who are interested in public health emergency response. It will introduce public health emergency planning issues and describe public health roles and responsibilities during a disaster. After completing this course, you should be able to recognize the importance of emergency planning for local public health, list the 4 phases of emergency planning, identify the essential components of an emergency plan, and understand the role of local public health in an emergency response. This course is organized into 4 parts. We'll start with an overview of emergency planning. In Part 2, we'll discuss the 4 steps of the emergency planning process. Part 3 will explain and define the components of an emergency plan. In this section, we'll emphasize crucial public health issues and concerns. And lastly, we'll discuss how to implement a proven and properly crafted emergency plan. A final summary will provide a quick review of the key concepts covered in the course. The first thing to understand about emergencies is that they are inevitable. Emergencies are going to happen, and they can have serious consequences on a community. Your role is to reduce the impact of an unplanned disaster. This is why emergency planning is so critical. So, how do we plan for an emergency when we don't know what it will be, where it will strike, or when it will occur? Let's begin by looking at our main objectives for any emergency management plan. Prevent fatalities and injuries, always our #1 objective. Reduce property and environmental damage, and improve recovery and return to a community's normal operations. There are many examples where the lack of an emergency plan has resulted in human injury or casualties, severe property loss, and prolonged delays in a community's recovery. In emergency management, planning focuses on protecting the public. Emergency planning does more than show you what to do when emergencies strike. For example, the planning process may help you recognize a lack of equipment, supplies, or staff. Many times you don't know what you're missing. A plan points out the gaps you need to fill. You may discover a new hazard or risk situation in your community. Additionally, emergency planning promotes a community's commitment to preparedness. Effective planning considers all potential hazards and threats, from small incidents to larger disasters. A small incident can cripple a town or lead to human catastrophe. It's optimal to divide potential hazards into 2 categories. Natural disasters. These vary by region but could include hurricanes, earthquakes, ice storms, wildfire, floods. An increasingly worrisome disaster that may span many geographic regions is pandemic. With the faster pace of international travel, this may be a larger issue than ever before. The second category is man-made disasters, which include terrorist attack, hazmat spill, power or utility outage, radiological event. Each of these events has the potential to affect the health of your community, necessitating a public health response. Unexpected or unplanned public health events can also impact the health of a community. For example, a foodborne illness outbreak, infectious diseases such as encephalitis or measles, water supply contamination. Each of these requires a public health response. A foodborne illness outbreak may require a field investigation and testing and treatment of victims. Infectious disease outbreaks may require mass vaccination or dispensing of medications. Response to a water supply contamination may be an activation of a boil water order or distribution of bottled water. If public health is not part of emergency planning, municipal planners may not see the value of involving public health professionals during a disaster. This could lead to slower response, incomplete solutions, and poor outcomes. Although the types of emergencies may vary greatly, many of the effects are similar. Let's look at opening a mass shelter. Consider two different emergencies. The first is a severe weather event, such as a hurricane. The second is a hazardous materials release. Emergency management may issue evacuation orders for either event and consequently open a mass shelter. Setting up, opening, and managing a mass shelter follow a uniform set of procedures, no matter what event preceded it. Many of the events we identified earlier can be managed with similar responses. Planners address these common operations in emergency plans and create a plan that is flexible enough for use in all emergencies. This is called an all-hazards approach and simplifies the organization and reduces the length of the written emergency plan. Emergency management is an iterative, response-driven process. It follows these steps. First, an emergency occurs. A community responds and tries to limit the impact on life, safety, and property. This, in turn, leads to the recovery phase. A wise community then takes the time to reflect on best practices and lessons learned, which are used to revise emergency plans and help mitigate or prevent the impact of future disasters. Emergency planning is one of the components of the preparedness phase, along with resource allocation and prepositioning, and training and exercises. This is the area we'll focus on in this course. Collaboration between response partners, including public health, before an event will enhance a community's capacity to respond to all hazards and threats. Although each community's plans may differ, all planning processes should follow these parameters. Be community-based. Plans work best when customized to each community. Engage the whole community by connecting with not only responders, but also the community's population. A team approach is vital to a comprehensive emergency plan. You should encourage and promote participation from all community responders and stakeholders. Consider all hazards and threats in your emergency plans, from minor incidents to potentially large-scale disasters. Remember, even small events can have serious impacts. Identify local and regional resources available to support emergency response activities. Also include incident response tasks and accountability measures, such as reporting procedures and documentation needs. At the planning stage, it's important to work with other community agencies and organizations, as they'll provide valuable input and will offer better support when an emergency occurs. Who are our strongest planning partners? Potential partners include local emergency management, public safety, including law enforcement and fire service, municipal and government staff, public works and utilities, including private power companies, public health agencies, emergency medical services such as EMS and healthcare facilities, and community stakeholders. Let's talk about these other community stakeholders. Some populations may be more severely impacted by a disaster. For example, the elderly or physically challenged may be more vulnerable. Also, consider the following as planning team members: faith-based organizations, volunteer organizations, and private businesses. Each of these groups may be able to provide resources, volunteers, or supplies. It's important to develop relationships with all your community stakeholders. Their views should be taken into account and incorporated into the emergency plan. If they wish, it may be also possible to assign them a role during a disaster. The plan is more likely to be used and followed if the stakeholders have a sense of ownership. Each community has different response partners. Take a moment to consider who would be on your planning team. As you can see, the planning team should be drawn from various organizations and agencies which have a position or stake in emergency response. It's essential that public health be part of emergency planning. Planning meetings provide an opportunity to gather and discuss all issues related to a disaster, including health risks. A collaborative approach will help all response agencies understand the role that public health will play during an emergency. So, how do we create an effective, robust plan? The planning process has 4 basic steps. For each step, it's important to consider alternatives and contingencies. Step 1. We start by conducting an assessment of a community's risks, including all potential threats and hazards. Step 2. Develop an emergency plan. A proper plan should address these areas: mitigation, preparedness, response, and recovery activities. Step 3. The emergency plan is tested using exercises and drills, or sometimes during a real event. Step 4. Maintain plans by reviewing and revising them. Anytime the plan is tested or implemented, carefully review lessons learned and adjust the plan accordingly. The plan should be an organic, living document. The first step is to conduct a hazard vulnerability analysis, often abbreviated HVA. The purpose of an HVA is to identify potential hazards and emergencies. A good place to start is with the past history of your community. Don't forget recent events. Data on naturally occurring events such as hurricane frequencies or 100-year floodplains may be available from local emergency management agencies. Next, gather information about your community's existing response capabilities. Include any aid or support from neighboring communities. Often, they can provide equipment, staffing, or other help. Once you've listed hazards and capabilities, examine it critically to analyze the impact of these potential emergencies on your community. Where are the gaps? Can they be filled? What do you need most? Time and money certainly impact and may limit a community's level of preparedness. The planning team decides which hazards must be planned for and what resources will be needed. Hard choices may need to be made. The list of possible hazards should be your guide. Plan for the most likely and/or most disruptive events first. Public health plays a crucial role in emergency planning and can help in many ways. They may provide data on frequency and probability of health-related risks. This kind of data is vital. Contribute response capability information such as equipment caches, staffing, and preparedness levels. In many communities, public health officials are the only source of this information. Understand the impact of health-related threats on the community, including different demographic groups. Public health input is important to appropriate planning for and protection of all groups. Here are some examples where public health may offer information on a community's level of preparedness for outbreaks of infectious illnesses, such as pandemic flu or West Nile virus, mass sheltering capabilities. Public health may offer staff and shelter equipment, such as cots and wheelchairs. Public health can offer guidance on the health and safety risks following a biological, chemical, or radiological event, either deliberate or accidental. Public health may have the only reliable data on a community's special population profile, including the elderly or physically challenged, who may be at a heightened risk during a disaster. Often, these groups present the biggest issues and greatest potential for poor outcomes. Recognizing vulnerable populations will help to ensure a successful response. Every community faces a different set of hazards. Take a moment to consider what are your community's hazards and threats. Is there a history of powerful storms in your community? Is a nuclear power plant in range? Are you located near a major highway which could have a chemical spill or catastrophic accident? Your community has a unique risk profile based on its vulnerabilities, level of preparedness, and available resources. Remember that there's always a possibility of an unanticipated hazard, which is why developing an all-hazards plan is crucial. The second step is to develop the plan. The goal for all emergency plans, from state and federal plans to a local institution or agency, is to provide an organized, cohesive response. All levels of stakeholders and response partners must coordinate plans to ensure an integrated response. Written agreements between partners may be established as part of the planning process. This reduces the chance of communication issues or gaps in the chain of command. One useful planning approach is scenario-based discussions. Think of a disaster that may occur. How should you respond? Planners compare the goals and requirements to respond to high-priority disasters by walking through an incident's potential developments and decision points. The more specific and detailed, the better. Visualizing how an emergency might unfold helps planning team members determine solutions. It also helps identify gaps or highlights the need for different alternatives. We'll take a closer look at the details of the written plan in Part 3, the emergency plan. The third step is to test the plan. The purpose of a test is to identify and predict any problems with the written plan. Responder workshops and training educate both individuals and teams to ensure that they know and can perform their assigned roles. Tabletop exercises are discussion-based walkthroughs of a plan. Functional and full-scale exercises are conducted to practice all or critical portions of a plan. Of course, your plan may be tested without warning as well during an actual disaster incident or event. Shortcomings in processes, materials, personnel, and infrastructure may be identified and learned from. The fourth step is to maintain the plan. A thorough review after an exercise or actual emergency will highlight those processes that need improvement. For example, lack of key resources or communication breakdowns may be identified. Public health can help determine the effectiveness of their response actions and also assess risks and costs. Public health may make it easier to keep up with best practices from other communities. Maintaining the plan is a constant process of reviewing your emergency plan for gaps and weaknesses, revising policy and procedures as needed, incorporating lessons learned. Changes in resources and capabilities are also important benchmarks for updating your emergency plan. We've discussed the steps of emergency planning. Now we'll focus on the emergency plan itself. What is an emergency plan? Let's start with a definition. An emergency plan is a written document that provides organized processes and procedures to prepare for, respond to, and recover from an emergency. Emergency plans are sometimes referred to as an Emergency Operations Plan, or EOP, or an Emergency Response Plan or Management Plan, depending on the community. The written plan contains basic information about responding to an emergency. What response actions are needed? Who should respond? When should the response start and end? What resources are needed? The emergency plan may cover just the response processes. A more comprehensive plan may also have sections for prevention and mitigation efforts, and short and longer-term recovery activities. However, every emergency plan should be flexible enough for use in all emergencies, based on the hazards and threats identified in the Community Hazard and Vulnerability Plan, which we discussed earlier. Comprehensive emergency planning consists of the following components: staff and responder roles and responsibilities. Who is responsible for what procedures? Emergency authority and succession, including who may activate the emergency plan. Incident response guidelines. What tasks need to be accomplished? Community and regional resources. What staff and equipment are available, and how do you request them? A local hazards and vulnerability analysis, or HVA, the snapshot of a community's preparedness, and a continuity of operations plan, or COOP plan. A plan should comply with local, state, and federal regulatory requirements. A well-written emergency plan provides guidance on carrying out response actions. It's best to keep it as visual and simple as possible. Use checklists and flowcharts to summarize important information. Remember, it'll be used in an emergency. Keep it as concise as possible. Let's circle back to public health. What is public health's involvement in an emergency? They include some everyday public health activities such as risk communication and public information to inform and educate the public, monitor and control of infectious diseases, and environmental protection. Other specialized public health emergency functions include mass care and sheltering, mass fatality and mass casualty, and mental health support during a disaster, including emotional and psychological first aid. Public health may be tasked with a number of assignments to support a response. You may be asked to respond to an emergency by running a emergency dispensing site, mass shelter, mental health relief station for responders and disaster victims, or ensuring safety during a hazardous materials incident. You may be asked to supervise public health personnel and other responders, including volunteers. Experience has shown that volunteers may self-report following a disaster. It's great to have help, providing you have the ability to organize and utilize volunteers. Public health may need to manage and verify the credentials of clinical and non-clinical volunteers. They may coordinate volunteers, categorized by the type needed, such as medical or mental health assistance. Also, you may be called upon to prepare and conduct on-the-spot training on health and safety response issues shortly after an event occurs. You may be also asked to communicate with other public health responders or regional and state public health. Depending on the incident, public health may conduct risk messaging to communities' residents, Public health may provide information such as educating the public about measures they can take to protect themselves during a pandemic. Effective communication before, during, and after an emergency to a culturally diverse audience is critical. Remember that individuals with limited English proficiency and individuals with disabilities should be included in your communications planning. With the advent of 24/7 news coverage and the demand for continuous information, public health may need to prepare media releases and public service announcements to ensure consistent health messages. This one area can make the difference between an effective response and a poor outcome, as well as the public's perception of your performance. You may need to serve as liaison to other response partners and community stakeholders such as healthcare facilities, including hospitals and long-term care facilities, independent clinical providers, vulnerable populations advocacy agencies such as councils on aging, and group homes. Public health may disseminate situation updates and coordinate incoming requests from response agencies and organizations. Or you may be a technical advisor, providing guidance for the safety of responders and the public, environmental protection concerns, HIPAA and privacy issues, mass fatality management. For example, public health may monitor exposure after a hazardous materials release and prioritize the populations most at risk. In addition, public health may provide advice on protective actions related to direct and indirect exposures. You may conduct field studies and investigations and provide consultations on disease and injury prevention and precautions. You have specialized knowledge that no one else has. Use it. Public health can serve many roles during an emergency. Take a moment to consider what roles you may fill. When a disaster strikes, you may end up filling more than one role, depending on the number and availability of response staff. Many of these roles conform seamlessly to your skill sets and training. Where can you help? Another often underserved area is of mental health. The effects of a disaster can result in not only physical damage and trauma, but also impacts the mental health of responders and victims. One of public health's responsibilities is to offer mental health assistance during and after a disaster. Stress and grief are normal response, as are disorientation and depression. Disaster mental health support may include not only counseling, but also organizing meals and beverages or communication services such as phones. Any sort of support can mitigate psychological stress. Many agencies have response roles during an emergency, and effective planning and coordination of assignments is critical. Regardless of the emergency phase, the plan should guide, organize, and unify all agencies' tasks, including public health. A good plan clarifies roles and responsibilities based not on individuals, but on their positions during a disaster. You never know who will be able to report for duty during a disaster. Roads may be blocked or notification systems may be down. If the plan functions around roles, important tasks are more likely to be accomplished. Many communities and government entities use the Incident Command System, or ICS, as a method to coordinate the many agencies during a response. This tool is used to organize the command, control, and coordination of emergency response. All levels of U.S. government are required to use the Incident Command System for management of emergency events. ICS provides first responders and authorities with the same foundation for incident management to handle all hazards, reducing confusion during what can be a chaotic situation. Incident command helps responders understand their roles so the emergency plan can be implemented smoothly and successfully during a real emergency. Benefits of adopting ICS are greater efficiency. ICS is designed to direct efforts in a crisis situation. With ICS, every individual knows their role and every role is identified and utilized. Better coordination with outside agencies. An emergency may involve many organizations. ICS can mean the difference between successfully using these resources and inefficiency. More effective communication. Using common terminology and titles. Confusion is common during a disaster. Standardized communication mitigates this risk. This chart illustrates the basic incident command system organization. Each box represents a role or area of expertise. The incident commander manages the overall incident support with help from his command staff, the liaison, safety, and public information officers. The 4 chiefs are responsible for, respectively, planning, operations, logistics, and finance and administration, and support the incident commander's response goals and objectives. In emergency situations, the local jurisdiction's fire chief, police chief, or town manager most commonly will assume the lead role as incident commander. However, each community may use a slightly different approach in incident command organization. In this chart, Public Health reports to the Operations Section Chief. The key to using ICS effectively is its flexibility. ICS can easily expand to match the changing scope of an incident or be reduced as an emergency moves into the recovery phase. An incident's actual organization chart may vary depending on the complexity of the event. A small apartment fire requires a smaller response than a widespread ice storm, in which all of the ICS positions may be assigned. The chain of command refers to an orderly line of authority. Public Health is a key player within the incident command system and also has their own reporting structure. Depending on staff availability and the size of the incident, this structure might include Public Health leadership to make critical decisions, Public Health management to coordinate the response, and staff and volunteers to help support carrying out assigned response tasks. You may not know the number of staff and volunteers available during the incident, so be prepared to be flexible. One of the most important areas of emergency preparedness is continuity of operations planning, or COOP planning. Functions critical to public health should be identified before a disaster happens and be incorporated into planning. Activities may have to be prioritized based on scarce resources. There may not be enough staff or supplies to carry out core public health tasks. Let's look at a model. In the event of a pandemic, a community has identified 3 critical response functions. Disease surveillance. Who has the disease? Where is it the most prevalent? Public information. What information does the public need to know and when? Mass dispensing. What medications are available and how are they distributed? Your community needs to ensure that they can provide the above functions in an environment that may be threatened, diminished, or incapacitated. In an event so severe that normal operations are interrupted, other routine public health duties may have a lower priority, such as restaurant inspections or retail tobacco enforcement programs. Essential public health employees should be aware of their response assignments during emergency conditions and understand emergency notifications and reporting protocols. You may be displaced from your primary work location and need to be relocated to an alternate facility. Depending on the nature and size of the emergency, the roster of essential staff and their assignments may be modified as necessary. What essential functions do you need to plan for? Tasks that you deem non-essential may be delayed until additional staff and resources become available. Divide your list into 2 categories. Think about what functions need to be performed regardless of a disruption. Next, think about those functions that could be deferred if necessary, depending on the severity of the emergency. The emergency plan is activated during planned events, such as training and exercises, and unplanned incidents and events, such as actual emergencies. It's important to test the plan with relevant partners to ensure that all responders receive training in not only response procedures, but also the incident command system. An exercise will identify areas that need to be strengthened or modified. The plan will also be tested during actual emergencies and disasters, as personnel and equipment are mobilized according to the established procedures in your emergency plan. Training and exercises improve ability to cope with an emergency. Training for staff and volunteers may include classroom and instructor-led classes, demonstrations of procedures or equipment, and web-based trainings. Volunteer organizations such as Medical Reserve Corps or Citizens Emergency Response Teams may conduct regional training events. Drills and exercises provide an opportunity for responders to apply their skills. Participating in exercises enables public health staff to become more comfortable with emergency procedures. Routine testing of the plan through exercises, drills, and tabletop discussions are essential to successful performance during an actual disaster response. Public health training entails educating both responders and the community. For example, a community may need to be educated about personal preparedness. Volunteers may need instruction on identification and credentialing before reporting to an emergency scene. Responders may need to be educated and fit tested for personal protection equipment. Orientation and education about potential emergencies and how to respond to each type of emergency should be provided before a disaster occurs. When a disaster or an emergency occurs, there is little time for training to be conducted. If training is needed at the time of a disaster event, we refer to this as just-in-time training. That concludes the content of our course. Let's review what we've learned. You should now be able to recognize the importance of emergency planning for local public health. List the 4 phases of emergency planning. Identify the essential components of an emergency plan. Understand the role of local public health in an emergency response. It would be nice if we could simply prevent disasters or completely mitigate their effects. Since that's not possible, the best approach for emergency responders, including public health, is to plan to limit the impact of an emergency.